Okay, first let me. Hello everyone. Now I am going to tell you about mitral stenosis. In mitral stenosis, first let's go about murmur. Now in stenosis, so I'm not into cardiology. So even though how much ever time I think about the pathophysiology, sometimes I miss in murmur. So therefore I started to have clues. So for mitral stenosis, MS, I have this D like MS Dhoni, and so I remember that it is a diastolic murmur. Beyond that, it is much easy to remember that it is a mid diastolic murmur, and it is commonly abbreviated as MDM, mid diastolic murmur with opening snap. So this is the murmur which we hear in mitral stenosis. Here in mitral stenosis, in one of the MLE exams, in NBME questions, it is written that a right-sided S4 is seen in mitral stenosis. What does this mean? Is S4 really possible in the right side? Of course it is. I will be making videos in detail about S4, but till then I will tell you what an S4 is. The S4 is the heart sound which is heard when the atrium empties into the ventricle, but the afterload is high, such that the ventricle would have undergone a hypertrophy, or there is a restriction in the ventricle, or anything for that matter. So when the ventricle per se is of smaller size, as seen in restrictive cardiomyopathy, or when the afterload is high, and when in that case the blood which is emptied from the atrium to the ventricle makes a sound, that sound is S4. Here in mitral stenosis, if you see, there is the stenotic, the mitral valve is stenosed. So the stenotic, because of the stenosis, the left atrial pressure is high. Since the left atrial pressure is high, it gets transmitted to the pulmonary veins. The pulmonary vasculature also, the pressure is high, which has been transmitted back pressure to the pulmonary artery. And because of the increased afterload, there is an S4, that is right-sided S4 is seen in mitral stenosis. Right-sided S4 is in, and it is possible. Fine, and the reason is what I said now. Then what are the reasons for mitral stenosis? In mitral stenosis, the reason is that, excuse me, okay. The first most important reason for mitral stenosis is rheumatic heart disease. What happens in rheumatic heart disease? In rheumatic heart disease, even though it is because of group A streptococcal infection, there is molecular mimicry. The body wrongly attacks the heart valves, mistaking it for the organism, because the M protein which is present on the heart valve is almost similar to the one which is present in the organism. So this is known as the molecular mimicry. When something attacks, right, then the valve gets disrupted. So initially here they will be having mitral regurgitation, but over the years the valve will undergo scar and it will result in mitral stenosis. So rheumatic heart disease is the most important reason for mitral stenosis, but they will not be presenting initially. Like immediately after the disease, that is after rheumatic heart disease, they will be having mitral regurgitation, but over the years, that is in the late adulthood or else in the early adulthood, the child who would have been attacked by the who would have suffered with mitral rheumatic heart disease during their childhood will be presenting with mitral stenosis in their adulthood. That's what you should remember about this. The second most important reason is that endocarditis. But what kind of endocarditis? If you see, this is known as marantic endocarditis. Marantic endocarditis, or it is also known as non-bacterial thrombotic endocarditis. What does this mean? Non-bacterial. So as the name says, it is not due to bacteria. So what can it be due to? It can be due to two important reasons. One is malignancy. What happens in malignancy? In malignancy, certain malignancies will be presenting with in a hypercoagulable state. Therefore, they will be having small verrucous lesions over the valve, resulting in mitral stenosis. The second important reason is SLE. The SLE can also result in merantic endocarditis or else non-bacterial thrombotic endocarditis resulting in mitral stenosis. These are the two important reasons for mitral stenosis. When is surgery indicated? These type of questions are generally asked in step 2 CK. And what type of surgery is indicated? First, balloon valvuloplasty. As the name says, a balloon is inserted in the mitral valve such that the mitral valve opening can be increased. Balloon valvuloplasty is the first priority, but mitral valve replacement is done if balloon valvuloplasty fails or if the mitral stenosis is very severe, such that when it has undergone calcification, say when the mitral valve has undergone calcification, what is the idea behind balloon valvuloplasty? They will have a small balloon and then they will allow it to enter in the mitral area, that is through the left atrium, and they will inflate the valve such that the mitral valve also opens. I mean, inflate the balloon and the mitral valve also opens. But if the valve has been calcified already, then that is not possible. We cannot inflate, we cannot make the calcified valve increase in diameter, right? So when the valve has been undergone calcification, then mitral valve replacement is the choice. The third one is the dyspnea. So if the patient suffers from dyspnea, that is if the mitral valve stenosis is very severe, then also mitral valve replacement is done. So this is in short about mitral stenosis. I hope you understood the concepts. Thank you for listening. All the best for your exams.